So the question was basically asking for an authoritative source regarding pulling HPI elements for multiple chief complaints. Not talking about chronic illnesses. We're just talking about, patient come in there. Patients like me, when I go to the doctor, I like to save all of mine up so that he gets more bang for his buck when I go. So he has a lot to choose from when I go to the doctor. So people who are like me who may want to go in there complaining about, knee pain, and then they want to complain about ringing in the ears, that type of thing. So the only authoritative source that you're going to be able to find is going to be whatever carrier that you're billing for. CMS isn't even going to be the authoritative service on this because every carrier can set their own guideline that they want to use for determining their HPI. I can give you some rule of thumbs, but you're still going to have to go back to that carrier. In the question, there was a statement that said the coder must choose elements in HPI based on 1 cc chief complaint. Whichever chief complaint has the most HPI elements and that benefits the physician the most. I, like probably a lot of other auditors out there, do not like that statement. One, I don't like blanket statements. And the statement isn't completely right, and the statement isn't completely wrong either. So I think what I disagree with is just the wording, and I didn't want to sit here and go, yep, I agree with that, and then you think that that's the way it is a blanket statement. So really and truly, I don't like a blanket statement. So I'm going to give you just a couple of examples, and once again, you're going to have to go back to your carrier and get their official word on how they want it done. Now, I'm a remote coder. I don't go to the carrier. I go by whatever facility that I'm billing for because they have already gone to the carrier in my place, so that's good, and I don't have to do all that research my own self. But one place that we coded for, I used all of the elements from the CCs that were addressed in the HPI and then did a total sum. So if one chief complaint only gave me duration and location, and then another chief complaint gave me modifying factors and quality, then I would count each one of those so I had a total of 4 to do that. So, just mixed and matched until I got one. I do know that there are parts of the United States that will allow you to count an element twice, such as if you had shoulder pain and you had that for 5 days and you had chest pain for 2 days, then the chest pain and the shoulder pain each counted for 2 points for location and then 2 points for duration because each one gave you a duration. Now, I would be leery of using that unless I got that directly from a carrier. Now, if that did happen, woo-hoo, we need to know for that. I mean, that's like sliced bread right there. That's great news. To do that, there's also been one that's probably more about what your question is related to, and that would be where you do pick the chief complaint with the most elements, not the one that does the best for the physician, the most elements. But you still get to use those other CCs, but you would use them as associated signs and symptoms. So you'd get, an extra point for doing that. And maybe that would give you your 4 that you would need. So it really and truly the best thing I can tell you is you're going to have to go to your carrier. As with all auditing, we always have to go back to the carrier that we're auditing for. So if this is a Blue Cross Blue Shield claim, then I'm going to go to Blue Cross Blue Shield of whatever state I'm in, and I'm going to say, hey, how do you treat your multiple chief complaints for your HPI? How do I count those elements? And then that's what I'm going to do for that. That's the basis of auditing. We always have to audit per carrier guidelines because CMS does not give us a definitive guideline that every carrier uses. Some they do, some they don't. This would be one that's a little bit on the gray side. So you do need to go to your carrier for that.
I was just going to add that, when you're talking to the carriers, you should try and get it in writing.
Absolutely.
What I used to do when I ran my rehab practice and we had to deal with it, if I had a phone call, I'd always write a letter and I'd say, per our conversation, it is my understanding that blah, 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 and I'd restate what we spoke about and basically send it to them so that if they, wanted to contest it, they'd have to write back. So that's just
right.
a little tip.
Absolutely. And absolutely you do. You want everything in black and white.
Yeah.
Because you know what it is. If it's not in black and white, it never happened.